I have
Hello?
already. Yes.
Okay, we're gonna start from now. Yes.
Hello? Hello?
Hello.
Yeah, I'm Dr. Alia Musa, one of the surgical doctors working here. May I confirm your name and age, please?
Yeah, my name is Philip Smith. I am 75.
Nice to meet you, Mr. Phillips. I understand that you are here for your surgical assessment. If it is okay with you, I would like to ask you a few questions regarding your condition to gauge your overall health fitness. Is that okay with you?
Yeah, carry on, doctor. It's okay.
Okay. Mr. Phillips, how does the pain affect your daily life?
I can't move around much. I need my wife too much to help me with the stairs, with the steps. Sometimes the pain prevent me from get out of the bed. You know, it has been for a long time.
Okay, I'm really sorry to hear that. Do you have any difficulty with walking?
Thank you, doctor.
Do you have any difficulty?
Yeah, absolutely.
It
Yeah,
must-
I can't walk for more like 15 or 20 steps maximum.
I'm sorry for that. Mr. Phillips, do you have any heart problem in your past?
Yeah, doctor. I have done, they did to me 2 operations on my heart.
You know the name of them?
One was open, they cut into my chest, and the another was through, I don't know, a catheter or so. They put it in my leg, and they fixed something.
When did you do this operation?
The first one, I think about 15 years ago, and the second after that by 5 years. You know, I don't remember the details much.
Okay. Do you have any difficulty with breathing when you lie flat?
No.
Do you have any chest pain or not lower limb swelling?
Not since my doctor put me on this new medication.
Which medication? Can I know it?
I take warfarin after my surgery. They changed something in my heart and they put me on it. And I take some tabs for my hypertension and also some tabs for my, I don't know, they say they have irregular a problem or irregularity in my heart.
Okay. What is the dose of warfarin?
3 milligram.
Okay. Mr. Philip, do you have any lung problem in your past?
Yeah, I'm asthmatic since my childhood. But I don't take a regular medication. It's just when I feel that I can't breathe well, I took this 2 or 3 puffs.
Okay. Mr. Phillips, do you have any problem in your kidneys?
No.
Do you have any high blood sugar?
No.
Do you have any stroke in your past?
You mean to my head?
Yes.
No.
Okay. So, Mr. Phillips, do you take other medication in your regular base other than warfarin and?
Yeah, I took warfarin and I took this for my blood pressure and for the irregularity and other one for the high lipids.
Okay. So, Mr. Phillips, do you have any allergy against any medications?
Yeah, I'm allergic to penicillin.
Okay. So, do you have family history of same chronic illness you have?
Yeah, my father died of a heart attack when he was 60 years. And also my aunt was from the same problem.
I'm sorry for that. Mr. Phillips, I want to ask you personal question. Is that okay with you?
Yeah, go on.
What you do for living?
I used to work at the grocery store as a and in a counter, but since this problem with my hip, I can't stand for a long time, you know. So
Yeah.
I quit working. Now
Okay.
my wife supports me.
So okay. I'm sorry for that. So, who live with you other than your wife at home?
Yeah, me and my wife only.
Okay. Do you drink alcohol or smoke cigarette?
Right now, no.
Okay, Mr. Phillips, what do you thought from your operation and you most concerned about?
Time
Yeah,
finished.
I'm afraid that it will affect
Time
my
finished.
heart.
Time finished. Okay. Okay, doctor. Can you present your patient, please?
Okay, I would like to present Mr. Phillips, 75 years old, who came for preoperative assessment for total hip replacement. Patient have history of 2 operations, heart operation on the past, and patient asthmatic, and patient have hyperlipidemia, and also patient took warfarin and an inhaler, but not in regular base, and antihypertensive medication. And patient
All
have
right.
family history of heart attack, her father and aunt, and also patient is allergic to penicillin.
Okay. Anything else?
Okay, nothing.
All right. Could this patient go for surgery today?
No.
Why?
Okay, this patient on warfarin need to stop 5 days prior to the operation, and also patient have many comorbidities, so patient need anesthetic evaluation before surgery for optimization.
All right. Do you have any general idea about the preoperative workup? What does it include?
Okay, full history and full examination and full investigation, blood laboratory blood investigation like full blood count, liver function, urea liver function, and renal function, and image like chest X-ray and ECG and echo and chest X-ray. Okay, and the case should be discussed in multidisciplinary team, including endocrinologist to control blood sugar, and hematologist for warfarin, and cardiologist for hypertension, and orthopedic consultant and anesthetist.
All right. That's fine. That's all. Thank you. It's a small history station. It's not difficult. And as you can see, we put it in the atypical history station because it didn't follow the same aspect that we used to, right? So it's not like the previous one. So we created another category called atypical history station and did the first one of them. Iman, on the exam, the patient will be very talkative. Okay, so Aliyah, your patient will not allow you to like, he will be very talkative. Okay, doctor, I have this hip pain, started 19 years ago. Then he will also confuse you by saying, I have heart attack, I have myocardial infarction, I had TIA, my back hurts me, my legs hurt me. So the patient will be very, very, very talkative. When you practice with each other later on or on your personal time, the patient should be more talkative, okay? And I'm going to give you a quick example. Ask me a question. Let's start from the family history. Ask me a question, Ali, about family history.
What?
About family history. I wanna give you a small scene about what's gonna happen in the exam. Let's just discuss the family history. Me and you, I'm the patient.
You have any family history of similar condition?
Oh, doctor, but there's a lot of things going on my family. I'm not sure if you want to know all of this, but the story started with my mom. She had diabetes. She had hypertension. She also had amputation 10 years ago. She had a couple of episodes of strokes. And then she had another myocardial infarction. They did a procedure for her. I don't remember the procedure. They take vein from her legs and they inserted it into her heart. And after that, she has another episode of heart attack. So she had 3. My dad also has a lot of problems. He had hypertension, diabetes, asthma. We used to give him inhaler for his asthma. He used to go to the GP 3 or 4 times a week. Do you know this? Will you allow me to talk like that? You need to intervene, Aliyah.
So what I should do, I can interrupt you?
I had this station in my exam. This is exactly what's gonna happen.
Mhm.
You should interrupt by being politely, okay, Mr. John or Mr. Smith. Okay, so your dad has diabetes, hypertension, asthma. Anything else? So you try to summarize what did he say and ask him for another thing. Do you know what I mean? Like you summarize and ask him close question. Anything else? The patient will be very, very talkative.
Okay.
Okay?
Mm, okay.
Muhammad. I think you asked about most of the questions. There's nothing I can add to. You asked about the stroke, cholesterolemia, family history, social history. Your purpose is to evaluate this patient, and there's not a lot of question in the discussion. So the patient will be talkative. Don't inhibit the patient from talking. Let him talk, but also reorient the patient back to your main purpose of discussion. All right?
Okay.
Yes. Aliyah, you did very good. This station be more common recently.
Thank you.
And this station mainly about the past medical history and drug history. So I have a point, just mention the pre-operative workup for this patient. I think the time finished before you answer this question.
No.
She answered.
It was within the three minutes.
Okay.
Yeah.
The next station.
Anyone want to add anything for the rest of the group?
Yeah, what about the anesthetic history? Sorry for interruption.
Sorry, Muhammad?
What about the anesthetic history? History of anesthesia. Any complications with anesthesia? What the type of anesthesia used if this patient had a previous surgery?
Yeah, the type of the procedure that he's having is different, right?
Yeah,
Or
I noticed this.
He's going for
Total hip
another
replacement.
hip replacement.
Yeah, but in
Muhammad,
case
you
if
mean?
the patient, yeah, I
Yeah,
mean if the patient has a previous surgeries, I think it's supposed to ask him about the anesthetic history.
Yeah, I think
Right?
you are
Yeah.
right. Yes.
Yes, you are right.
Muhammad, did she ask?
No, she
No,
didn't
no.
ask.
I
think so.
didn't notice
I
this.
didn't ask.
I don't think so. Okay,
I
ask
didn't
the Aliyah.
As the patient have 2 history of surgery,
surgery.
so you need to ask about any complication from anesthesia.
Okay.
From the
I will
previous one,
do.
we forgot about that one. Did we write it in the school or no? Let me check.
I wrote from the school.
Sorry?
Even I think it's not in the school. You have to re-edit it.
But
in the
yes, not
skeleton.
on the
Ali,
school.
don't think
the
it's in the
scenario,
school.
the
I don't
scenario,
think in this question.
the scenario,
Okay.
there is no history of surgery in the past. I think in the school there is no history of surgery.
Yeah,
But the
this
patient
man,
Iman said he have 2 history.
oh, okay,
past.
okay, Muhammad, just no. I just want to make a clear point here. If the patient had hip replacement before, then we need to ask about the anesthesia.
Yes.
But if the patient, this is his first surgery, then obviously he has no surgery before, then you can't ask about the anesthesia.
Yes.
The scenario we wrote in school is an elderly man who is undergoing hip replacement. So he has no procedure before. But I'm asking, in the exam recently, do you know the scenario?
Yes.
Yeah, whenever the patient mentions surgery, we should ask him.
Yeah, I heard about the scenario came in Cairo,
Yeah.
I think, in such a station about a patient is going to hip surgery, and the patient had a long list of previous surgeries, including cholecystectomy, tonsillectomy in the childhood, and excision of nevus.
All right.
So
in this,
I think in this situation, we have to involve the anesthetic history.
Yes. In this case, we're going to update the school, and we'll make the scenario with the previous history station, and we will put a question about the previous anesthesia. That's very fantastic point, Mohammed.
We'll make another scenario.
No, in the same scenario, we'll change the scenario to a scenario with a man who had previous procedures.
But the
And
most
then
common scenario is very surgery, Ali.
Various surgery or without surgery? I just want to make this clear.
Without the most common scenario without surgery. But recently,
I'm not
as
sure, I don't know.
Muhammad said, there's the last exam, there's a couple of surgery, as he said.
Okay, so I think it does make sense. If we added a history of anesthesia, that would be easier for everyone. So they don't forget about it, Muhammad. Even if the case has no history of procedure and you asked about it, this will not refuse your mark. But if there is a history of surgery and you didn't ask about it, then that's a problem.
Yes.
So we'll add the anesthesia. All right. Muhammad Kamal or Muhammad Yusuf?
لا yes, Muhammad Kamal.
The one who added the point is Muhammad Yusuf, right?
Sorry.
No, Muhammad Hassan, it's me.
Muhammad Hassan, thank you. Thumb up. That's a good point.
All right, it's okay.
School. Our aim from school is to create a community so everyone can add. So you are the one who's gonna create this one, and I'm just gonna give heads ups for those who are gonna take the exam in June. You're gonna update most of the school. Okay, this will be updated accordingly. So if the new scenarios is if the new scenario there is a surgery, then we're gonna do that. We'll add the surgery part. All right.
The next session.
I have a comment, Dr. Ali.
Yes.
In the personal history, she asked Mr. Phillips if he smokes. He answered not now. So I assume he was smoking, and given the crucial history of his hypertension and cardiac disease, she should elaborate more on this. When he stopped, or how much has he been smoking and for how long?
Yes.
Is that relevant?
It's very important.
Mm.
It's crucial though. If I thought he said he didn't smoke. I didn't hear not now.
He didn't smoke.
Say not now.
No. Yeah, she said not now.
Iman, you said not now. Okay, if you said not now, then Alia, you need to ask. I thought Iman said I didn't smoke.
I heard her not smoke.
Me too. But if as Ali who said
Iman.
as Iman said now,
Mhm.
and who made the point? Asia? Who made the point? As Ali said, Sahad said, if he mentioned he is not smoking now, you need to dig back into history and ask him, have you ever smoked before and for how long and how many cigarettes per day? Okay? If he said he's smoking. Obviously, if he's not smoking, then nothing to do. All right?
Session is impotence.
Okay.
Yes.
Who will be the doctor and who will be the stimulator? Muhammad Hassan?
So,
I'm
you know,
the doctor.
Muhammad is covering the night today. He's covering the on-call and he's here.
Yeah. Muhammad
That's
Hassan.
why, yes.
Yes, you are a hard worker like me, right? We always work. We always do our duties. Yeah, so good job. I want to thank you for coming, even though you are on duty.
I hope
Okay.
that we'll try to improve our experience by you, sir, under your control.
That's my
Muhammad
pleasure.
Hassan.
Yes.
Hello,
Muhammad Hassan.
hello.
Muhammad Hassan is
Yes. Can you
the doctor,
be-
right?
I'm the doctor.
The doctor Muhammad
Yeah,
Kamal
Muhammad
Ali.
Hassan is the patient. All right.
Yes.
You want me the actor or what?
Yes. Could you please open
Yeah.
school and follow the scenario?
Or if you don't
Alright.
want to,
And if you
then
don't want, you
anyone in
can
the-
manage it.
It's okay. It's okay. It's okay.
Okay.
Go ahead.
Okay.
Start.
Can I start?
Start.
Or still?
Yeah.
Okay.
Yeah.
Good
Let
morning,
me put
sir.
the timer,
My
give me
name.
a second.
Okay.
I put a timer.
Yeah, start now.
Sorry. Hello, sir. My name is Dr. Kamal.
Yeah.
I am one of the surgical team working here. Is it okay to speak with you?
Yes. Go ahead.
Thank you, sir. Can you please address for me your name and date of birth?
Yeah, my name is Michael and I'm 65.
Okay, Mr. Michael. You want me to print chaperone for you? Or is it okay with you to the chaperone to attend with us? Or is it okay with you?
It's okay, doctor. You can go on. I don't need a chaperone.
Okay, okay. I know that you're coming today for discussion, and I want to make sure that for you, our talking today will be so confidential and no one knows anything about it, okay?
Okay.
Okay. First of all, sir, can you please give me, what's the problem now? How can I help you?
Yeah, doctor. I have, as I can tell you, from a man to man, I'm experiencing difficulties to initiate erection. I'm strongly concerned about this and have family troubles regarding this recently.
Okay. May I ask you, this problem, is it constant, started gradually or started suddenly?
Actually, started gradually over the last couple of months.
Okay, mister. And do you have noticed any morning, there is any factor that make it worse or improve it?
Yeah, actually, I have a lot of stress in the work nowadays, and that's why I think it's reflected in such problem.
Okay. What about you have any nocturnal or morning erection?
No.
No. And do you have any problem with penetration?
Yeah.
Can you explain more for me, please?
Actually, no, during the sex issue, I can't do the penetration. As I told you, I'm facing troubles with my wife because of this.
Okay. Do you have suffer from premature ejaculation?
No,
No.
I can't ejaculate anymore.
Okay, understood. Sorry to hear about that. Okay, can I ask you another question, sir?
Yeah.
Okay, I will ask you about your sexual behavior, sir. Okay,
Mm-hmm.
are you married?
I'm married.
Do you using contraceptive?
No.
Okay, do you have do you have sexual intercourse recently?
Yeah, about 5 days ago, I tried to have one, but it failed because of my problem.
What about your libido? Is it affected?
Yeah, I have a libido, but I can't experience it. You can understand me, doctor, as a man.
Yeah. I
Yeah.
totally appreciate that. Yes, totally concern.
Yeah.
Your concern, to totally appreciate it, sir.
Thank you.
You and your partner, you have satisfaction during your relation?
Recently, previously, yeah, I satisfied my partner, but recently because of this problem
Yeah.
I can't. And that's why I had a lot of conflicts with my wife because of this.
Okay. Okay. Do you have feeling tiredly recently or feeling asleep?
Oh yeah, doctor, you can imagine. Yes, I do.
Okay. Okay. Appreciated and understood. Do you suffer from fever?
No,
Do you suffer from abdominal pain or change in habit, bowel habit?
no,
Do you suffer from short of breath or cough?
no,
Do you feel any abnormal in your heartbeat, heart palpitation, or chest pain?
no. Yeah, actually,
All
recently
right.
opened.
Sorry?
Over 1 month. Over 1 month, I had chest pain, some breathlessness, and I can't walk for long distances. Like, I have to take a rest, even if I want to go to the grocery.
All right. Do you have family history of similar situation like that?
No.
Okay, I'm going to ask you a specific question, sir, about your life. Is it okay with you?
Yeah, go ahead. Sure, doctor.
Okay. Do you have any chronic do you have any chronic diseases?
Yeah, actually, I'm hypertension and hypertensive, and I have some medication. I'm having some medications to control of my blood pressure. I'm a diabetic, and recently
Time finished.
I'm a
Time finished.
diabetic.
Time finished. 6 minutes. Okay, doctor.
Okay.
Can you present your patient, please?
Well, I'm going to present my patient, Mr. Paul. He's an old guy, old gentleman, had erection abnormality started once a time, and now it bothering him and give him more irritability and disturbed his relationship with his wife, and he denied any chronic diseases beside hypertension and diabetes, and he's on treatment.
All right. So what's your differential diagnosis?
Well, I think that it may be erectile dysfunction due to social stress in his job, and actually maybe due to some kind of medication, because I didn't hear his medication. I think atenolol or something. Yes.
All right. And let's say this patient presented to your clinic. How will you work him out? What's your investigation?
Well, after I have examined him thoroughly, I have to do a general investigation first, blood investigation, full blood count. I have to do for the renal liver function test, renal function test. I have to do hematinin. I have to do other investigation to work up like that. There is hematological and there is radiological. The hematological also we have to do other investigation and prostate-specific antigen. The radiological we have to do ultrasound for the penile arterial duplex ultrasound for the penile arteries, and we have to do ultrasound for his abdomen to work up any other abnormality in his abdomen or prostate.
Okay. What else? What else?
There is other level of investigation. Actually, I'm not remembering. I'm trying, but
That's fine. Okay. You said a couple of radiological, right? Okay. How will you treat
yes,
your
ultrasound,
patient?
sonographic, yes.
Okay. How will you treat your patient?
First, we have to treat the predisposing factor. We have to reduce this stress. We have to improve his social life. We have to encourage him to take healthy food, take exercises, and improve with his condition about his diabetes, about his chronic diseases. And after that, we have to tackle his problem and there is some kind of sildenafil given drugs for, I don't know, 5-estradiol drug for increasing the blood supply to the arterial
What
blood
is the
supply.
mechanism of action of sildenafil?
Honestly, I don't know, but honestly,
All right,
Time finish.
that's fine.
honestly.
Time finished. Yeah. Okay. Last question.
And there is also surgical disease. Sorry.
What's your invasive therapist? Yeah, or surgical therapist? What's your invasive therapist?
There is some kind of implants, soft or hard, inserted in the penile caverna itself for satisfaction of implant for erection.
All right.
But actually,
fine.
I'm trying to. Yes.
That's fine. Okay. Good. Muhammad, if you don't
Yes.
see it, I see it. Every day is better than the day before, even though you just this is the third day. Okay.
What?
It's not a-
What? I can't. What?
Every day is
You're
better than the
improving.
previous day.
Okay.
Every day is better than the previous day. Good history. There's a couple of points I will mention, but I think putting in mind this station is not easy one. It's not an easy station in Bhutan. It's quite complicated, and you did very good in it. All right.
Well, actually, I'm trying to remember the questions, but you know,
Yeah,
your
it's not-
school, your history is so detailed. That's why I'm trying the question even, but you know, I
Yes.
forget something. Many,
While you're driving your car, do you listen to our video that we
more than
created?
4 times.
All right, good. I think that will help a lot, and it did help.
This is actually, to be honest with you, I have listened to you now today. I even in the last day, 4 times to 5 times through the audio, and I have write it with my own hand,
Good.
all the station
All right.
with
good.
my own hand from A to Z, but I can't remember it because it's, you know.
Yeah, it's not easy, and it does need a lot of practice. Let's do a couple of points.
And don't forget, I am on call now.
Yeah. Firstly, you asked for a chaperone, which I like. If you forget, you asked for a chaperone, right? You did. You said, do you need a
Yes.
chaperone? Yeah.
Yes.
This one of the most important stations that you need to ask for a chaperone. You don't ask for a chaperone for every single station, but this one you need to ask for a chaperone because it's a sensitive station. All right. When you ask, so basically what Muhammad did, he didn't point you to a specific diagnosis, which I like, especially.
Yes,
He
I
want
have
you to
noticed that also. He's trying
Yes.
to make me sticky.
But he gave you the diagnosis in the last second. In the last
What
second
was
in
it?
the history.
Yeah.
hypertension.
Yes.
It
The
was what,
hypertension.
my friend?
Hypertension with beta blockers.
Yes, I didn't hear beta
This-
blocker.
I
Actually,
didn't
I'm
mean
trying to hear it.
hypertension.
I'm trying
Yes.
to hear the
Mr. Ali,
treatment.
I didn't mean the hypertension. I throw him the tip. I throw him the clue and the last of the history. When I said that I'm hypertensive, I'm a diabetic, and I have a pain while I walk that I need to rest, which is
Yes,
intermittent
you said that,
claudication,
my friend. I'm
which
trying to
means
remember.
which
Yes.
more consistent with Lariche syndrome.
Yes, which is very good. So here you have like, okay, when you think about this station, it's either his heart problems or his social stressor or his beta blocker that he takes for hypertension. When you ask him, do you have nocturnal erection? He said, I don't have nocturnal erection.
Yes, I said that.
So in this case, your first differential should not be impotence due to social stressor, because in social stressor, you will have morning erection. You will have nocturnal erection. So by him
Okay,
saying,
this means that you have changed totally the scenario.
yes.
Okay. That's why I'm learning from you.
Yeah,
Okay.
and be prepared. Yeah, and be prepared for that. I'm here to train every one of you for being open. Don't memorize the station. It could be changed easily. So in this case,
Okay.
he told you, I don't have nocturnal erection.
That's right.
So when I ask you in the treatment, what's your differential? You shouldn't
I
say
put
the
it-
first one is
Yes.
social stressor. Social stressor should be the third differential or the fourth. The first differential should be my impotence due to heart problem, and the second impotence due to beta blockers. Okay.
Impotence due to heart. He said something about what syndrome? I don't hear it.
I'm not sure
Something-
about the syndrome. Yeah,
You said
but we will
something
ask-
about
Lariche
we will ask-
syndrome.
Leriche syndrome. All right. Lerech syndrome is the syndrome in which you have thrombotic abdominal aorta. No, internal iliac, sorry. In this case,
Aortoiliac femoral.
aortoiliac femoral, yes. There will be a block from up down there through the aorta, and this will lead to what's the call? Will lead to impotence. But this is not important now. Do you?
Okay.
You said
Do
you using, which is wrong. It's do you use. It's not do you using.
Okay.
Especially if your examiner was a UK doctor, he will not accept that from you. It's not do you using. Do you use? People will tell you grammar will not affect your mark. They are wrong, because grammar will show your professionalism. So don't ignore grammar. It's not like more important than the clinical stuff, but don't ignore it. It's not do you using, it's do you use.
Okay. Thanks. And okay, I'm listening.
Okay, so you asked about the libido. You asked about fever.
Actually,
fever has nothing
when
to
I
do
ask
with it.
about fever, I make confused. When you ask about the fever, I regret myself. Why should I ask about it? That's why
Yes,
I
fine. And if this happened to in the exam, don't blame yourself. Swallow it and move. Like if in the
yes,
exam,
that's why I swallow it and move, and yet you make me.
that's fine. I wasn't satisfied about your question of depression. You didn't ask all the question to exclude depression, because also
What do you mean?
depression-
Sorry, can you explain more, please? Yeah, can you explain
Okay.
more?
Okay. When you have a patient with depression, he usually will be like erectile dysfunction or impotence is one of the presentation of depression. All right. You ask
Okay.
him, do you feel tired? He said, I feel tired. You should ask him about the rest. Sleep.
Sorry?
Sleep. You should ask him, Aliyah, mute yourself, please. Sleep, anhedonia, and
What this one? Anhedonia, what do you mean by it?
anhedonia means like enjoyment of life. Anhedonia.
Okay.
So if he lost his anhedonia, does he wake up early? How about his appetite? So these are the symptoms of depression. And if you want to remember this word. Sick
Okay.
E caps. I'm gonna show you now.
E-cap.
Do you see this? Sick E cap.
SIGCA.
No, SIGECABS.
Yes.
Sick E cap. S for sleep.
Okay.
Sleep. I for interest.
Interest.
Are you interested in life? G for guilt. Do you feel guilty for whatever reason?
Guilty. Good.
Yes. E for energy. How about your energy? Do you feel tired?
Energy. Yes.
T for psychomotor agitation. Don't ask about psychomotor agitation. You cannot ask him if he has psychomotor agitation or not. I'm just giving you information about
Okay, I'll put it at the back of my head. Psychomotor agitation. And A?
A, appetite.
A, appetite. And
S,
B? No, there is B.
S.
CAPS?
No, sick ECAS. Sick ECAS. SIGECAS. The last
Okay.
S, ideation.
Okay. Got it.
That's how you exclude depression.
Okay.
All right? So you need to ask about all of them to make sure your patient is not depressed. Because there's also a reason.
Thank you. And
we put systemic review in school. Why? Because there's a couple of organic causes that may lead to impotence. For example, hypothyroidism or hypopituitarism. These causes, you just can exclude them by systemic review. Any headache, you will see if they any pituitary adenoma by just asking about the headache and the rest and visual disturbance. Any chest pain, any shortness of breath. So you need to exclude hypothyroidism from your differential also, because it also could be a cause of impotence. When you finished with drug history is crucial here, because probably your station will be the reason will be the beta blocker. So I think, Muhammad, you need to ask about this a little bit earlier. Don't let it at the end.
where exactly can you?
The drug history.
I mean, where exactly should I ask the drug?
Okay,
After I finish the.
when you exclude the depression, when you ask about
Yes.
the main complaint, he told you about the erection and premature stuff and every that thing. You did that very good. That's fine. Immediately after that, you ask him about the depression, and immediately after this one, drug history. Do you take any medication? So you have the main complaint. Immediately after it, the depression, exclusion or inclusion, and immediately drug history. What do you take for medication? Okay. All
Good.
right. Otherwise, fantastic, good. I think you answered all the question in the how to present your patient. Fine. Investigation. I think you need just to memorize the investigation. There are a lot.
Yes,
They
because
give-
I'm trying. You know, it's the more than 20 investigation.
Yes,
That's why.
But yes, you know, if but I want to give you a good way to memorize all of this. Just think in the hormone in your bodies. They all hormonal.
Because you have to ask in such a case, luteinizing hormone, FSH. And now I
MS.
remember it from your discussion, headache
Yes.
and pituitary and thyroid stimulating hormone. But you know, I'm trying.
Yes.
I'm trying.
So look, think, ask about them and think about pituitary. You will answer all of them. Just think about pituitary.
Even I'm trying to keep the implanted surgery. I forget. And by the yes,
And in the treatment, because this will be the last thing between you and your examiner, which is the last impression, we always focus about the first impression and the last impression. Don't forget
Yes.
the semi-rigid, like you have to remember how to say it. The semi-rigid implant and implantable implant. You have to say them. It's already in school.
Yes, it's
Semi-rigid
written in the school, but I forget.
Yes.
I forget how to do it. Yes.
Yes.
I told you there is
but-
some kind of implant, but I can't. I remember there are some semi-rigid and some is hard or something friable, implantable.
Yeah.
I mean, something like goes with air, something
Yes.
like that.
But overall, fantastic, good presentation. I'm just asking Muhammad, do you have any other point?
Just
Yeah.
to make this station easy, it's all about sexual history, which you can easy memorize by think by step: libido, erection, penetration, ejaculation, and the partner. In partner, you have two questions, which is satisfaction during the relationship and the stress. Is there any stress in your relationship? Then psychological history about, you need to exclude, as Ali said, depression by asking about the mood, about sleep and appetite. Did you notice any change in your mood? Did you notice that you woke up at early in the morning and you have a difficult to get sleep and appetite? After that, past medical history, social history, drug history, and so on.
Okay,
All right.
got it. Thank you, Doctor.
Good idea,
Thank you.
Muhammad. I think that will help you. So think about the steps of sexual intercourse from seeing your partner, then you will have your libido, then you will the erection until the end. This will give you how to ask about all the questions.
Can I ask one question,
All right.
sir? Can I ask one question?
Yes.
I noticed in the history, sir, even I have sent you privately. He said that Mr. Ball, some kind of mistakes. He said, Mr. Ball, yes, Mr. Ball. I don't know, there is some repetition. You can see it. I have sent you.
Yeah, I will review it. I will review it today, and we will update it if there's any repetition. But the name of the doctor is Alex.
Otherwise, I do appreciate your work on Dr. Muhammad. It's very fantastic school, but it's a challenging, very good, huge information. That's why I need to repeat it. So I can attend you now.
When is your
Yesterday,
exam? When is your exam, Muhammad?
No, my exam, it will be about December.
All right, good.
No, even December. And by the way, I told you, December, it's maybe December and even maybe in the next year. But I'm
October,
preparing
yes.
earlier.
Yeah.
Okay, good.
Easier.
Good job. That's fine.
Dementia?
Anyone want to add anything for the rest of the group?
Yeah,
Yes.
I think in this station, we have to take the strategy to exclude either this impotence of a structural cause or of a psychosocial cause.
Yes. Yes, Muhammad.
Yeah, and accordingly, you have to establish the theory to present the evidence. This is my addition.
And
Yes,
you do
he-
that by asking simple question about nocturnal erection, which will give you, is it a social or is it organic, right? Is that
And
what
ask,
you mean?
yes, and ask about
Yeah.
the stress relationship or
Yeah. So 2 questions will tell you if this social or organic. Do you have nocturnal and morning erection? If yes, probably this is an organic. If yes, probably this is a social problem. Because if it's an organic problem, this means it's in the material, so he will not have erection. And also ask about stress, as Muhammad said.
the next station is dementia. Who will
Any
do
other
this
point?
dementia?
I want, excuse me,
Yeah.
I want to ask about the point on the past medical history.
Yeah.
That is specifically ask about pelvic and spinal trauma and what the concentration in it, and also about Lear syndrome. Is that important related to this?
Lirech syndrome, you said.
Yes.
Lirech syndrome, I think Lirech syndrome could be included, but how are you going to ask the patient? Do you have Lirech syndrome? No, that's the Lirech syndrome. Lirech syndrome, usually we see it here. I'm working at vascular. So usually the patient will have, like, will be very old. He will usually have very severe claudication, rest pain, acute limb ischemia or chronic limb ischemia, and there will be numbness, neurological symptoms. He will not be young. He will not walk. That's why, like, when I removed it, I know there's other material circulating between you guys, but I don't think they just like copy and paste. We think before we write everything. So he's a young patient and he has a stressful condition and he has nocturnal erection. Lirech syndrome is not
Not related
differentiate.
in this
Yes,
one.
it
Yes.
can be differential
Okay.
diagnosis, but so far.
They may ask you what is Lirech syndrome. They may ask you what's Lirech syndrome. In this case, you're gonna tell them it's abdominal
Iliac.
aortoiliofemoral blockade or
Okay,
thrombosis, which will lead to erection, impotence, and neurological symptoms and motor symptoms.
Yes.
I will upload a picture for Lirech syndrome in this station just in case if they ask you about it. But I don't think it will fit. I don't think it will fit.
It
Ali,
came
I want-
before, Mr. Ali. It came before about
Before-
Lirech syndrome. That's why I intended to involve it in this station. It's a I'm also working as vascular, and it's a triad of impotence, intermittent
Yes.
claudication, and loss of femoral pulsation due to aortoiliac occlusion.
Yes. That's now vascular surgeon talks, Muhammad.
Can I have a
Yeah.
question? Just one question, sir.
Yeah.
Hello?
Yeah. We hear you. I'm hearing
Just repeat this point, please. If there is nocturnal erection, there is non-organic?
you. If there's nocturnal erection, that's non-organic because he is able to erect. That means he's just stressed about his life.
And if there is not,
If there's not, probably it's organic. Like low
Thank you, sir.
testosterone or hypopituitarism or the rest of the causes for impotence,
Okay.
thank you. Thank you.
including
Thank you.
Lirech syndrome.
Okay, thank you.
All right.
The next station is dementia. Who will do the dementia?
Oh, yeah, I just want to make sure, by the way. You know the circulating materials that I'm sure some of you guys use, it's not perfect. And some of the answer doesn't make clinical sense. We read everything circulating. We even read material here from UK. And we try to do our best in school. So please study from school. All right?
Okay.
Okay.
Dementia. Who will do the dementia?
Yeah, it's me.
Asia.
Who's the
or
patient?
Who will do the dementia?
Ali, Asia, I can be the patient. Hajar, yes. You can be the patient.
Thank you, Hadi.
Let's start.
Okay. First, can I have the name of the patient and the age, or not necessarily?
Not necessarily. Just choose any name, choose any age from your head.
Okay.
Start.
Good evening. My name is Dr. Asi Abdullah, one of the surgical doctors working today. Nice to meet you, Mr. John. I'm here to ask you some question in order to test for your memory. Is this okay with you?
Yes, it's okay, dear.
Okay, my question are going to involve some problem to solve, and maybe I'm going to ask you to draw some stuff for me, and I need you to answer my question as best as you can, okay?
It's okay.
Okay, Mr. John, can you tell me the name of this place we are in right now?
I don't remember. Don't find.
All right, no problem at all. Can you tell me the time to the nearest hour?
I think we are in the morning.
No problem. Can you tell me your age or your date of birth?
I'm feeling a bit confused.
It's okay. It's okay. Take it easy. So I'm going to continue with the questions. Can you tell me the year we are in right now?
I think 2020.
Okay. And can you tell me what is my job?
I think you are my daughter.
All right. Okay. So Mr. John, I'm going to ask you to count me down from 10 to 1. Can you do this?
Yes.
Okay, please.
10, 9,
Yeah.
7.
All right. Okay. Mr. John, I'm going to give you an address. I need you to put it in your mind, and I'm going to ask you about it at the end of our conversation, okay?
Okay.
It's a 24 Wixom Road. Can you tell me back what I have told you? What is the address? To make sure that you heard me well.
I didn't hear you well.
24 Wixom Road.
24 weeks.
Okay?
Road? Yes.
Okay. All right. Can you tell me when the World War II ended?
Maybe at the 70s.
Okay. Can you tell me who is the current Prime Minister?
I don't know.
Okay. Can you recall the address I gave you before?
Which address?
All right. Okay. Thank you very much. You've been helpful. Thank you very much, Mr. John. So the AMTS score of my patient is nearly 0. So it's suggestive of delirium and also dementia. And I'm going to complete my examination by doing MMSE. Shall I continue?
All right. Can you do the MMSE, please?
Okay. Okay, Mr. John, I'm going to continue with my questioning. Okay. Can you, Mr. John, are you here with me?
Yes, I'm with you.
Okay. I'm sorry. I have to go continue with some several questions. Okay.
Okay.
Okay, Mr. John. Can you tell me the season we are in?
I think it's winter.
Okay. Can you tell me the months?
It's maybe December.
Okay. Mr. John?
Yes.
Can you tell me the months?
I think it's December.
Okay, the date. Are you recalling the date or the day of the week?
No.
All right. Okay, Mr. John. Actually, I'm not recalling all of the MMSE.
That's fine. That's fine. Okay. And
okay.
Okay. Tell me how will
Let us
you
try until the end of the time.
Okay.
All right. Muhammad, can you manage this station? I'm gonna leave it for you. Okay.
Okay.
Okay. I'm going to recall some questions. I'm going to give you a paper, and I need you to draw for me two pectagons that are intersecting. And also, I'm going to give you a paper with something you have to do, and I need you to do it for me after reading it. No, I cannot recall all of the MMSE. Am I going to be asked about the MMSE in the exam?
Yeah, if you have a time, the examiner will ask you to continue by MMSE.
Okay, okay.
Try as you can. You have 40 seconds.
Okay, Mr. John, I'm going to give you names of 3 subjects, and I need you to recall them, okay?
Okay.
Apple, bed, and table, okay?
Okay.
Can you repeat them for me?
Table.
Okay. You heard me well? Okay, Mr. John. Can you subtract 3 from 5?
Time end. Time
What?
finish. Time finish.
Okay.
Uh,
Okay,
you did very good, Asya. Could you please present your case?
Okay, I took history from Mr. John, 75 years old. His AMTS score is nearly 0. He didn't score much in MMSE as well. That indicates the status, confusional status. That maybe it's just the delirium or dementia.
Okay. And how you will manage this patient?
Okay, I'm going to manage this patient by do first a full clinical examination. Then I'm going to do a close observation to the patient to detect any new early warning signs, and also monitor the the pulse rate, the vital signs of the patient, such as the pulse, the temperature, the blood pressure, and the level of consciousness. And then I'm going to do a lab investigation for the patient.
What is your investigation?
Okay, I'm going to run a full blood count, and I'm going to do a thyroid function test and liver function test and B12 deficient, it's a B12 level and glucose level, and also urea and electrolyte, and do septic screening such as chest X-ray, urine
What's the
analysis.
imaging?
Okay.
What is the imaging you will consider?
I'm going to run a CT for his brain to check for any cerebrovascular accident and space occupying lesion.
What else?
What else imaging?
Yes.
Chest X-ray.
Okay. Will you allow
As
her
part
to
of
go
septic
for
screening.
surgery?
As her surgery is not an urgent, he's going to total hip replacement. So no, I'm going to go back to my consultant and to the anesthesia consultant and give him the update about the case and discuss with them to postpone the operation.
What are the other reasons?
Other reasons for what? The operation is not urgent and the patient is not fully oriented. He's confused. So
Yes.
he cannot consent.
Yes. What is the MMSE?
The abbreviation of MMSE?
You have 40 seconds.
It's a mini mental state examination.
Okay. If this case is an emergency, will you allow her to go for surgery?
If the case is an emergency, it depends if the dementia is senile or it's acquired or secondary to a disease. If it's secondary to the disease, I have to treat the underlying cause. If it's senile, I'm going to consent the patient using a consent form 4 with the 2 consultant signature. I'm going forward with the operation.
Okay. Tell me 2 tests to be done on a paper to assess capacity.
I'm going to give the patient an order written in a paper and ask him to do it. And I'm going to ask the patient to draw a 2 intersecting pentagon.
Okay. The last question, what is the capacity?
It's the competence of the patient. It's his ability to believe information and understand the information and be able to take a decision according to it.
Time finished. Okay. Thank you.
Time finished. All right. Do you have more questions, Mohammed?
No.
Scoring system used in medical surgical patient to determine the level. Okay. What do you mean, Iman? And when should evaluate the patient?
Three.
You mean, do you want to ask about what scoring system that we use?
Comment that
What-
to Asia first.
Yeah, Asia, can you answer this question?
Question of what?
Iman,
What
what
is the
did you
question?
say?
Yeah, he
Iman.
dropped it. She dropped it. Yeah, she seemed like she forget it. And the scoring system you
Forget
used to
what?
monitor the patient.
I
Yeah,
didn't
you
use
said
score. I
the
didn't say
vital.
use.
Yeah,
I said it as a sentence. I
yeah,
didn't
the
say
vital
use. I
signs.
said
Yeah.
national. No, I said national early warning score,
National early warning score. All right.
and
that's
then
fine.
I said the vital sign.
Do you know other system? Do you know other system?
This is
For
this system
it's-
asked
it-
recently.
Yeah, but I'm asking them for their knowledge. Do they know any other system for surgical patient specifically?
I can't remember
Do
it.
you
I know
know-
it, but I can't
do you-
remember.
Do you know SAS?
Yes, SAS.
SAS.
Yes, SAS.
Surgical Apgar score.
Yes.
Surgical Apgar score. Zero.
This is in UK, doctor, or this is worldwide? SAS.
Worldwide.
Right.
All right. So good history taking, Asia. We put you in a very narrow spot when we asked you about the MMSE. Probably they will not ask you to do it, but you need to be aware. They may ask you to initiate it. Okay?
Yes. He will start by first two
Muhammad.
questions.
Yes.
And the time will finish. This patient is not talkative, but in the exam, the time allow you to ask just two questions in the minimental examination score. I will give you tips and tricks to easily remember the dementia, which the first one is ATMS. Like the first question about the hour, what's the time, what's hour near the time, and the year, the next question. Divide it into number and verb. Hour, year, date of your birth, your age, when the World War ended. And count from 20 to 1. These are six questions. Then ask in the second question about the street. After that, ask the patient about the name of this place, what's my job, and job of this patient here to me, and what's the current minister. This is the 10 questions for ATMS.
This can be added in the school, Dr. Muhammad, or as a
Yeah,
permission for
yeah, but this tips is not added. I will add it today, inshallah.
no, because this one is so precious. That's why I can't remember. You said tips and tricks. That's why.
Yes, you can divide it into number and verb about the hour, the year, the date of birth, the age, the World War end, and the counting from 20 to 1. Divide this question by could you remember this street? Then ask about the job and the man near to you about his job. And the last question about the minister.
All right. So we have numbers and persons. Okay, that's pretty cool. I think Muhammad, correct me if wrong. She was not supposed to ask about the patient name and age, right?
Yes, she
Yes,
asked about
because
the patient.
admitted.
She didn't ask about it.
No. She's not supposed to ask about them.
Yes,
She asked what's your name.
Yes, the patient will written in the instruction
Yes,
outside the
admitted.
exam room.
Asia, are you following?
Yes, I'm following.
When you enter the room, you ask, can you tell me about your name and your age, right?
No.
You
I
need
know
to-
that he's admitted he's supposed to go to the operation
didn't
and
ask
suddenly
you.
become confused. So I know his name and age already.
She didn't
Yes,
ask
she
you.
That's why I
Yes.
asked you if you have a name or age for the patient.
Yeah, but I'm sure you mentioned the name. I'm sure you asked him what's your name.
You tell me pick a name yourself, and I pick a name
yes.
myself.
No,
I
when
didn't
you
ask
Ali,
her.
she didn't ask you
Wait.
about your name.
I didn't ask. I pick the name myself.
She just
I
told
think-
you your name directly.
No.
She know it.
Yeah, I
even
know,
from
but-
outside.
Okay, I'm sure I heard her asking, "What's your name and age?"
If she
I'm gonna
asked,
go to
it's
No,
wrong.
she didn't. I didn't.
But she
She
didn't
didn't
I
ask
asked
his,
you.
your
I
name.
asked you before.
No,
if
you
there-
are okay. That I know. I'm not talking about this part. I'm talking when we start.
No, I didn't do it.
No, she
again.
didn't ask you, Ali.
I didn't.
I will review. I'm not convinced yet. I
Review,
will
review. Okay.
May I say a suggestion, please?
Okay.
Yes.
Yeah, let's do for exam setting. I think it depends upon the scenario given at the door of the room of the exam. And I
Yes.
think it depends upon the scenario. The most likely coming station is an already inpatient, admitted patient. And in this situation, I think probably they will give you the name and the scenario.
Yes.
Otherwise,
and
I
that-
think you
and
have
that-
to ask the patient.
Yeah, and that's what I'm saying. You are not supposed to ask about the patient name, and you are not supposed to ask about the patient age because it's already written outside. If it's not written outside and the first instruction was ask your patient about his name and his age, then you're gonna do it. And it's not just like that. Follow the instruction that you're gonna read in the first minute. Follow the instruction. If they told you the name and you don't need to ask the patient, that's fine. When we go to the procedure skills, they will tell you your gloves are already on. You don't need to wash your hands, which is like you're gonna take it from there. Okay. So depression. And today we're gonna practice the new stations that we added. The acute limb ischemia. Iman did a good job yesterday. She prepared it, and then we took it and we did some change and we created the same style as school. Okay. So we're gonna practice it today, the acute limb ischemia, the new station. And I think Iman gonna be the patient, gonna be the doctor, and I will be the patient. Okay, depression, before we finish with the last one.
Okay.
It's me.
Who's Hajar? Okay. And who's your patient?
Asia.
Can anyone see my patient?
Yes.
Yeah, can you be the patient for
Be the
depression?
patient?
I'm sorry. I'm having a noisy background around me.
Okay.
I don't know.
Okay.
If
Salma.
Salma Zahran.
Let me see who is in the meeting. When you
Yes,
are patient, you will benefit too, by the way.
Salma unmuted herself, Ali.
Sorry?
He has
I
bad
have
connection.
noise there,
Yeah.
but
Yes.
Oh, internet. Aliyah. Or Salma Manna.
Salma Manna.
okay. I will be the patient.
Okay.
Yes, you have depression, you are tired, you cannot walk, you cannot talk, you can do nothing. That's all.
Okay.
All right?
Start.
Start, Hajar. Let me put the time first.
I put the time already. Start, Hajar.
All right.
Okay. Good morning, Mr. John. I'm Dr. Hajar, one of the surgical doctors working here. How have you been recently?
I'm so tired.
Hello, Mr. John. Do you hear me?
Yes, I'm hearing you.
I'm so sorry to hear that.
Hmm.
I'm so sorry to hear that. In the past day during your last hospital stay, have you felt you are hopeless or depressed or feel down?
Yes, I feel depressed, and I'm lost interest in this life.
I understand. Do you found that you no longer enjoy or find your pleasures in your life?
Yes.
I understand. Have you been feeling very tired those days?
Yes, I'm tired all days and all times through the day.
I understand. So you may have difficulties in your sleep, right?
Yes.
Can you tell me?
I didn't sleep. I didn't sleep at the night for the last month.
I see. So Mr. John, are there any particular time you feel your mood is worse?
All the day I feel depressed and I'm lost interested to do anything in my day.
I understand. Mr. John, do you notice any change in your appetite?
Yes, recently I lost my appetite.
Is it less or more than usual?
Yes, more than usual.
Okay. Can I... Okay, yes, continue.
Okay, doctor. Nothing.
Okay. Can I ask you about your libido? Do you notice any change?
Yes, I decreased my libido. I'm not interested in it.
I see. Mr. John, have you ever felt this before?
Yes, in the past years, yes, I have symptoms like this.
So
Lost
you have
interest a couple of months and returned to my usual life.
I see. Have you ever had any problem with mental health before?
What?
Do you had any problems with your mental health before?
Yes.
Do you
Yes, I follow up with my psychiatrist.
And you think that was helpful for your condition?
Yes, when I met my doctor, that improved my life.
I see. Have you ever been admitted to the hospital because of your mental health?
No.
Okay, good. So have you feel you want to harm yourself or someone?
No.
No, I see.
Just I talk to everyone, let me alone.
Okay, I see. So I want to visit my patient based on my assessment. Mr. John presented.
Yes. Present your. You still have 2 minutes. Do you want to ask another question?
Do you feel tired this day? Do you feel you lost your pleasures in life? And so can you tell me more about this? About your mood?
Yes, I have bad mood at all the day, and this increase at the night, and I'm not asleep, and feel to be alone. No, I hope no one to talk with me.
I see. Did this affect your life a lot? Do you go to
Yes,
job
that affected my social, and that affected to my communication with my family, and that affected my work.
I see. I can understand this. Do you had any low mood episodes in the last years? What you have told me about? Any other episode you didn't tell me about?
I told you that in my last year I have the same symptoms, and I follow up with
Time finished. Okay, that's fine. Can you present your patient, doctor?
Okay. Based on my assessment, Mr. John presents with symptoms indicative of depression. He is feeling hopelessness and with decreasing his pleasure in life. He also reports excessive fatigue, disruption in his sleep pattern. He have difficulties and challenges with morning, mainly in the morning. Also, he is struggling to fall asleep and to wake from sleep. Additionally, there is increase in his appetite and decrease in his libido. Mr. John has previous history of episodes of depression. He attempted counseling and that helped him a lot, but he haven't been hospitalized for his medical health concern.
All right. How will you investigate this patient?
Firstly, I will do physical examination to see the sign contributing to these symptoms. Then I will request blood test, and he may need psychiatric evaluation and imaging study.
What do you mean by what do you mean by physical examination to check the sign? Like exactly what do you mean?
I will do a physical examination to explore if there is any problem cause this depression, either structural or conditions.
All right. What else?
I will test complete blood count, comprehensive metabolic panel, thyroid function test, vitamin B12 and folate levels. I may consider referring this patient for psychiatrist for more evaluation. He may need MRI or CT to exclude any structural abnormalities in his brain.
All right. And how will you treat this patient if he, like, putting in mind the levels of his depression?
Okay, treating of depression as all depend on mild or moderate to severe. From my point of view, I see that he had mild depression because he do not have any attempt to suicide, rescue, and also he haven't been admitted to hospital before, and he is on regular counseling, and he get improved from this counseling. So I will do regular exercise and sleep hygiene advice, some psychosocial therapy, and will put him on regular workup with his doctor.
All right. Let's say this was not helpful, and now he has severe hypertension. How will you manage him?
Okay, I will add medication therapy like selective serotonin reuptake inhibitors, and he may need high intense psychosocial interventions and immediate risk management. So I will admit him to the psychiatric ward.
That's fine. What do you know about the SSRIs? Can you give me an example?
I cannot remember this right now.
Remember sertraline. Sertraline is one of the SSRIs. All right, good. Very good presentation. Muhammad? Yeah, I just have 2 points to mention. You have a small grammatical mistake. You said, do you found, which is wrong, Haya. There's nothing called do you found. It's either do you find or did you find. There's no do you found. And when you said feeling hopelessness, he feels hopeless.
Okay.
Yes. Not feeling hopelessness. And you said to fall or to fail or something like that. Just review the record and pronounce it right. I think you were just in a hurry when he fell, I think, or something. Okay, Muhammad?
I have no point to add. Just I need to mention about the last station, which is dementia for Asia. I'm really sorry, it's out of the scope. But I remember I mentioned Mini-Mental score examination is necessary for neurological examination. And I think you asked me about it, but I think the meeting ended before I answered. As your exam after a few weeks, after a few weeks, so I will answer it. This neurological examination has 3 scenarios. All right. The first one, I think patient have persistent headache, do neurological examination. Here the diagnosis is bitemporal hemianopia. Mini-Mental score examination necessary in the third scenario, which female, I think, have insomnia and memory defect. Please do neurological examination and memory test. Here, you need to ask about the Mini-Mental score examination, not ATMS. So you will start first by your examination, and after finish your examination, ask about the Mini-Mental score examination. You get the point?
All of this. All right. All of this will be updated in the school. I'm glad you mentioned the dementia again. Asia, did you read it from school?
Not today. but
Yeah.
I've checked for it when you added to
You
school.
get this point
Previously.
at the examination?
I want everyone to open a school, please, and open Dementia. Go to the last thing. You will find surprise. You know the consent form 4. We added a picture for consent form 4, so you will have an idea what's consent form 4. You just must memorize.
Thank you for this addition. Really, thank you.
If you can, Muhammad is showing you guys the consent form 4. So we look, school will be day after day better, and I think the August guys are more luckier than the June one, because the June one will influence more the August. All right.
Many thanks, Mr. Ali.
Here, the consent form 4.
Yeah, I took this picture, by the way.
Is it allowed
Alright.
in your hospitals to take pictures like this?
I'm sorry, are they going, what is the question is going to be about this form? Or we just taking
Any questions
Okay.
about the consent form?
Okay.
You need to,
Just
no.
Actually, the last exam, this May exam in London,
Yeah.
one of the examiners was asking about all of the forms and explaining them in details, I think.
Yes,
All
but
right,
I mean,
so
if the form in a
when this
paper,
exam?
May.
I think
she said May, not
the May
okay.
exam,
May 2023?
I'm glad you mentioned
2024,
that.
last days.
Okay, so we will add all the consent form and what's the difference between them from 1 to 4. Okay, we'll add them in the school.
But
All
Iman, if you have more information about the question asked about the consent form 4, please send it to me.
Yeah, yes, okay, all right.
Thank you.
All right, so we're gonna finish today by the last station. Muhammad, if you can stop sharing, please. We're gonna finish today by the last station, acute limb ischemia. Iman, you created it yesterday, right?
Yes, I did.
Yes, I did some changes, and thank you firstly for doing that. I did some changes and made it our style on school, so we can practice it now, and this will finish all the station, and history is done now. All right, so should we start? I'm having trouble with internet connection. All right.
I can take
Someone
it.
open the whiteboard. Is it something or?
Muhammad, can you stop it?
Ali, I told you that I have problem to stop sharing. I don't know. I think Muhammad said that.
All right. Okay.
How about now?
I can take it
now
if
it's
Iman
fine.
couldn't.
Okay.
Okay, Muhammad, you said you're gonna do the acute limb ischemia, right?
Yeah.
All right. So we already made it in school today, but we will edit it later on. So Iman, if you can just type in if we missed anything or if there's a new question that we need to add. All right. So I will be your patient, okay?
All right.
And Muhammad, you can just follow us and put the timer, and let's see how we can perform.
Okay.
Let's start.
All right. Good morning. My name is Dr. John. I'll be your doctor today. Is it okay with you, sir?
Yeah, that's fine, doctor. No worries.
Okay. May I have a pleasure and know your name and age, please?
My name is Phil, doctor.
Okay, nice to. And how old are you, Mr. Phil?
I'm 66-year-old.
Nice to meet you, Mr. Philip. Mr. Philip, today I've been asked to ask you some questions regarding your current problem. Is it okay with you?
Yeah, that's fine.
Okay, so Mr. Philip, how can I help you today?
Doctor, I have severe pain in my legs, and I used to walk like for 100 or 200 miles, and then it's getting less and less. Now I cannot even walk for 10. I cannot even walk for 10 meters.
Oh, I'm so sorry to hear that. Perhaps we are here for helping. So, Mr. Philip, would you tell me when did this pain start with you?
Oh, okay. So what do you mean, like the progression? or it started 10
No.
years ago, but it's
Oh,
getting
I
worse.
see.
Yeah,
I see. Did it start gradually or sudden also?
yeah, gradually.
Okay. Does it come and go or persistent?
It does. No, it's just when I'm walking. Like it's not like a pain when I'm rest. If I walk, I feel the pain. If I'm rest, I'm fine.
Well, I see. Thank you for sharing these informations. And can you prescribe the pain for me? Is it dull, sharp, crampy?
It's
Or
it's like a cramping pain, cramping and burning, both of them together.
yeah, I'm so sorry for that. And anything make it better?
Staying in bed and not moving.
Okay, I see. And anything make it worse rather than walking?
Coldness. When I'm like when the weather is very cold, it's also it does give me pain.
Yeah, I see. And a score from 1 to 10, whether 10 is the worst pain imaginable. How can you score your pain?
Okay, so the pain gets severe while I'm walking, so it will start around 3, and if I continue to walk, then it will reach 10. So it's like a scale of a pain, doctor.
Okay, I see. I'm so sorry for that. You need anything right now?
Fine now because I didn't walk for a while, so I'm okay.
All right, Mr. Feb, I would ask you some questions to figure out the possible causes for your problem. So, can you before how many distance you can estimate before you are having to have rest?
Now around 20 meters.
20 meters. And before you were able to walk longer than this, isn't it?
Yeah.
Okay. And I would like to ask you some questions about your past history, if you don't mind. So, do you have you ever suffered from such problem in the past? I mean, before the 10 years before?
No. It's just like I have diabetes and hypertension. So, yeah.
Thank you so much for sharing these informations. And regarding diabetes and hypertension, are you on any long-standing medications?
On what?
Are you on long-standing medications for the diabetes and hypertension?
Yes. I take metformin, 500 milligram, and I take lisinopril, 2.5.
Thank you so much for sharing such information. And is there any problem? Have you had any medical admission to the hospital for any reason?
Yeah, I was admitted a couple of times for my leg. And I have this like ulcer, but on my like the tip of the toes. But now I'm okay. I got recovered from that one.
Okay, I see. Any surgeries in the past?
Any what? Sorry.
Any surgeries?
No surgeries.
Okay, is there anybody in your family member has suffered or suffering from such problem?
Yes, my whole family has cardiac issues and limb issues.
Okay, before I go further, I would like to ask you, do you have any idea about your problem?
Yeah, I think it's related to my arteries, and I think my arteries are affected. One of the doctors told me this before, and I think it's getting worse now. The problem is getting worse and worse.
Any expectations?
I just don't want any amputation, to be honest, because my family had a lot of amputations.
Okay, any concerns about it?
Yeah, the amputation too concerning me.
Okay, well understood. Mr. Philip, do you smoke?
Yes.
How many cigarettes?
1 cigarette a day.
1 cigarette. And for how long?
20 years. Time finished.
Okay, what about?
Time finished.
Thank you.
Can you present your patient, please?
Okay, today I took a clinical history from Mr. Philip, a 66-year-old diabetic and hypertensive patient with a long-standing history of intermediate claudication for progressive intermediate claudication. Started about 10 years ago and became more obvious and progressive as experiencing a shortness in the claudication distance. The patient on metformin and lisinopril for the diabetes and hypertension, and the pain is exacerbated by walking and cold weather. And he had a family history of diabetes and hypertension, had the previous history of admission because of lower limb ulceration, which
Okay.
made the...
That's fine. What do you think the main differential?
Yeah, in this situation, the main differential would be a chronic lower limb ischemia. I will put in mind also peripheral vascular disease. I can put also possibility of orthopedic origin, of course, like osteoarthritis, and also I can put DVT on my list.
Okay. What's the most important investigations that you will start with?
Yeah, the most important investigation for this patient, I will consider imaging with arterial Douglas ultrasound.
All right. And let's say you did the arterial Douglas ultrasound and it was abnormal. What's your next step up?
Yeah, for investigation, I can consider CT lower limb angiography.
All right.
Or,
and let's say your patient has CT contrast allergy or his renal function tests are very bad. What will you do?
I may consider magnetic resonance angiography.
Okay, good answer. How to treat this patient?
Yeah, for treating of this patient, I need to evaluate the patient first and examine him thoroughly, to examine the neurovascular examination of both lower and upper limbs. And then I have to commence some other investigations like blood investigation, including CBC, random blood glucose and glycosated hemoglobin, and renal profile also. Then I may discuss the patient in the multidisciplinary team meeting for further discussion. The modality of...
Time finished. Good.
Okay.
Very good. Very good. Very good presentation and very focused, good history. You finished with the time. I'm doing vascular. So from vascular point of view, that's a very good presentation. It's quite complicated, this station. If you make it complicated, if you want to put yourself in trouble, you can easily put yourself in trouble. For example, when I told you I have ulcers, that was a distraction for you. If you keep asking about the ulcers, then you're going to miss the station. You just need to ask me, okay, where is the ulcer and for how long? That's all. And keep track on what you're doing. I want you to update the school at the moment. Just update the app by pressing down. I did a couple of changes and a couple of improvements. When you say your differential diagnosis, chronic limb ischemia, the differential diagnosis, but peripheral vascular disease is not a differential because chronic limb ischemia is one type of the peripheral arterial disease. Okay, so you have peripheral arterial disease. It has chronic limb ischemia, acute limb ischemia, and critical limb ischemia. I think I will make another lecture about the vascular in general. But peripheral vascular disease is the umbrella. It's like a big problem. It does contain three: acute limb ischemia, chronic limb ischemia, and critical limb ischemia. Chronic limb ischemia, critical limb ischemia is chronic limb ischemia plus ulcer or gangrene or rest pain. That's the most important definition. Yes.
Or ABPI less than 0.3.
And this is all about one differential diagnosis: is peripheral arterial disease, as you said, acute, chronic, critical.
Yes.
We need to ask about other differential diagnosis, compartment syndrome, and DVT.
Tissue loss. Iman said tissue loss. By tissue loss, we mean two things: either gangrene
or
ulcer. So the word tissue loss, you have critical limb ischemia, tissue loss, and ulcer tissue loss means ulcer or gangrene. All right, gangrene wet or dry.
My point, Ali, here
Yeah.
Now you are exclude one differential diagnosis, which is the peripheral arterial disease, maybe acute, chronic, or critical, as you said, but he need to exclude DVT and compartment syndrome by asking about any history of trauma, any history of numbness, and DVT asking about calf swelling and shortness of breath.
Yes, I wanted to. It's not written in the school yet, Muhammad.
Yes.
Because we just wrote the station now, like today, and Iman gave us the structure yesterday. And to write a station like this is a lot of work. We will update it now. The sensory and the motor function tests are, the sensory and motor are very good point. And also there is a third differential, which is like from clinical point of view is very important. You know, spinal stenosis. Spinal stenosis.
This is my point. Spinal and vascular.
Yeah, is spinal claudication. So if you have a patient who has claudication, it could be spinal. And the way you ask, do you feel are you better when you're climbing up the stairs? Are you better when you're climbing above, like when you're going up, for example, climbing? If he feels better by climbing, that means it's spinal.
Yes.
But the vascular one will feel worse if he climbed, if he walked, if he cycled, if he swam, whatever. As long as he's using his legs, he will feel the pain. Okay? So don't make sure, we wrote it in the school. This one is mentioned in the school, that's the spinal stenosis. The one that's not mentioned, Muhammad, and we need to add it, the DVT and the compartment syndrome. All right? Even though I'm not convinced enough that DVT is quite different than acute peripheral vascular disease. In the DVT, you will see the vein. The vein will be more than 3 millimeter diameter. So
yes, but the main complaint is claudication, lower limb claudication.
Yes, but DVT put it the last one in the differential. But the compartment, all right. I don't want to expand a lot on this because probably you are not going to need this, but I'm going to give you a couple of point important information that you need. If you have compartment syndrome, what's your treatment, Muhammad? Real quick.
Fasciotomy.
Fasciotomy. All right. And if you have compartment, if you have a patient you did embolectomy for, and then he developed, if you have a scenario of a patient who has embolectomy, and then he may develop compartment syndrome, then the treatment is fasciotomy. Good answer. All right. Fine. I don't have any other point. Can you let me share, Muhammad, the screen? What I'm going to say next is very important. Share the screen. I want everyone to pay attention.
I allow you.
Yeah. Am I sharing now? Okay.
Yes.
So look, everyone. You know here, you know this one, August 2024. You are only people who can see this. Not everyone can click here. Why? Because we choose to give only some member have access. Not everyone have access. All right. Here you will have the lecture. For example, this is the first lecture we did about the history. First session. Here, this is the second session. You have the practice and you have the lecture. The practice, you can hear yourself here. This is your session that we did. All right? And here you have the lecture. Let's say you want to revise this one. You will find the lecture completely. I made the lecture on my personal time for you guys. So you can revise from here, the seizure, all right? And then you go here and listen to the practice. So we have the lecture and the practice. Third session, we did the lecture for acute pancreatitis, IBD, shortness of breath, headache, and dysphagia. We will upload the session today. And this will be the fourth session. In every session, you will have lecture and you will have practice. Watch the lecture first, and then watch the practice. Is that clear? I just want to make sure everyone knows how to get access to this. Can you type in a comment?
In practice, you can see yourself to improve yourself. Okay. Don't need to watch all the video about the practice, but the lecture you need.
You can watch yourself, or if for example you have a problem with pulmonary embolism, for example, you can go and open the practice and see how we did the pulmonary embolism. All right. We put a lot of time in this. Please use it. Use it. If you follow those guys, you will pass your exam. And I just want to also mention another thing, by the way. Here we have our lead board, Muhammad Kamal.
Yes.
In the last 7 days, you are #1 pro.
Actually,
So-
because I didn't know how to use the school. If once
Yes.
you teach me, now I just keep to eat it.
Yes. So we have here our lead board in the 30. So okay, how you can earn point here? For example, I'm gonna give you a secret. Later on, I will create a lecture. I will create a lecture for those taking the exam, but I will just take the first 4 from you guys. The first 4 participating here. So this point has a price to it. These points mean you will have access to some courses that not everyone have access to.
Is there any money for it?
You know, I'm giving you a course that people charge a lot of money for free. So,
Well, totally appreciate it, sir.
yeah, it's my pleasure. So how you can earn points, so you will be in our private group, just comment, like, share, post.
I read
the
from the
community.
school and press on
But
tag
how
after
can we
reading.
share? You said this is private platform. Share what?
No. Right
What
here
share?
right in the like what I'm doing now. Open on the community and write whatever you like. Right?
You
Okay.
mean notes and communication. You mean
What
something
you
like
like. If you have a question,
Just
if
if
you
you
have
need
an idea,
someone to
if
practice
you
with
have
you.
tricks and tips, and we will
Actually,
we will
just
create.
I have write one comment for you because I was sick. You can see it now in the
Yeah,
first station. That's one comment.
I can see it now, and I want to remind everyone by just one click here, I can see what did you study and what you didn't study. So we will have a good idea. Let's say I want to
Salih.
Take
Where
me,
Salih?
open my file if you want.
Salih
I'm ready to go.
or Muhammad Kamal.
Open my file if you want.
Let's
It's
say,
okay with me, sir.
Muhammad, membership here,
Yes.
courses. I can see you wrote, you read 12% of the 12%.
Yes, because I open it now today. Yes.
And look, if for example I don't like you, you know what I can do? I can just take you out of the course by just one press.
Yes.
But I like you, I won't do that. So keep using the app. Okay, that's all for today. If you have any question, drop it for me or Muhammad. And thank you, everyone. And
What
we'll-
about tomorrow, doctor?